Good evening, everyone. Thank you for making the time to join us on Wednesday, March 17th, 2021. We are now officially at the 1-year mark since the pandemic has begun and we entered some safer at home orders. And more importantly for all of you, there began to be restrictions on folks who are not working in a long-term care facility from entering. And we acknowledge it has been a long year and there have been many sacrifices made. And likely at this point, you were just so excited to see your family member and you want to know those specifics. So tonight we have gathered with our Deputy Health Officer for Contra Costa County, Dr. Sarah Levin. She's going to talk to us about where we are as it relates to guidelines related to visits to long-term care facilities for folks like you who are friends and family. And we're going to talk about kind of where we're at. We sure you have lots of questions and we're open to those. We invite you to leave those in either the chat or the Q&A, and we will do our best to get to all of them. Some of you have sent your questions in advance and we appreciate that. We want to remind everyone that this is being recorded and we will share with everyone who registered tomorrow. We will send you the link. We also want to say that like the whole entirety of this last year, it's like surfing. So we know what we know now when we're trying to stay on the board, and that things might change, and we will share that with you. So we anticipate as things continue to unfold, we'll come back to you and provide more education. So with that, I'm going to turn it over to Dr. Levin, and I'm going to ask her to sort of outline what we currently know as it relates to visits.
Good evening. Thank you, Nicole, for that lovely introduction. It is amazing that on this St. Patty's Day, we are a year since the first shutdown in the nation went into place here in the Bay Area. And it is really encouraging to know that that I'm coming to you tonight with the opposite, that we are now saying, yes, it is time to bring back visitation in the facilities that we knew were at greatest risk and where we have lost so many of our Contra Costa residents. And I don't want to not acknowledge that 30% of our deaths in this county have been associated with long-term care facilities. So this has really been a population that, although there were so many sacrifices made in not being able to hug and be with your loved ones, we, I think, are in a better place in this county than in many places around the country because of the protections that were put in place. And I just want to thank all the friends and families for really doing their best to make it through this year, to communicate in other ways with their loved ones, to keep coming at us with how can we make it better and how can we do our best to provide guidance to facilities that allowed for the ongoing psychosocial, emotional, physical well-being for these residents. So tonight, I'm glad to say that there have been changes in the policies and the guidance coming from the regulatory agencies that our county is planning to follow along with those regulations that are specifically coming to the skilled nursing facilities as their regulatory body. We don't have an update from the Department of Social Services, but regarding visitation, but generally as a county, as we've done from the beginning, we're sort of providing the guidance to these facilities, the residential care facilities for the elderly and the SNF along the same in alignment. So I just want to, I do want to go over first the changes that happened in terms of the guidance coming from CDC for fully vaccinated people with regard to the recommendations or the guidance from the general public versus in healthcare facilities. And in their guidance, healthcare facilities does include, they call it out, the residential care facilities, the assisted living facilities. So just to make sure that people are clear about that, because I know facilities have been getting questions. So the new guidance that came from CDC for fully vaccinated people around gathering is to the general public was that they can now have gatherings indoor unmasked for fully vaccinated people or for with unvaccinated people who are at low risk for severe disease. So we know that that is not this population we're talking about. The guidance, however, for healthcare facilities remains that within these facilities that you need to maintain the core principles of infection control, which include physical distancing, masking, frequent hand hygiene, okay? So I just want to be clear that as we talk about the visitation policies, there's still those principles that are really a must within these facilities, okay? All right, so I'm going to just quickly go over the current visitation guidelines that are coming from CDPH versus CMS does have issued, the Centers for Medicare and Medicaid Services issued a couple days after CDPH issued a new guidance letter. CDPH is more permissive for visitation, and they have made very clear that that's the one that we're to use and the regulatory bodies are to use. So, and again, this applies to the skilled nursing facilities, but as a county, we are aligning it with our residential care facilities for the elderly as well. So CDPH says that every facility must have a visitation policy and accommodate for visitors, whereas the CMS says should. So that's one thing. Every facility must have a visitation policy that allows for indoor visitation regardless of county tier or outbreak status, whereas CMS says that they could limit visitation based on community prevalence, positivity rate. So that's our T, what we in California are calling tier, or if they have less than 70% vaccinated. So from our perspective, right at this point, it does not matter what tier the county is in, nor what status of outbreak the facility is in. All facilities must allow for indoor visitation, okay? There is one caveat in the tier, in the policy, which is that if we are in purple tier, then, which we are not anymore, I'm happy to say we're in red tier, but if we are in purple tier, the only fully vaccinated persons at the facility can receive indoor in-room visitation, okay? If we're in purple tier, they still need to allow for visitation outdoor and indoor in communal spaces, but that's just that caveat gets added for if the resident themselves is not vaccinated, okay? The other thing that's now been allowed for is that if both the visitor and the resident are fully vaccinated, then they can have physical touch. They call it brief limited, but I think the intention is really to allow for those, for that contact, that physical contact, to maintain the mental, psychosocial, spiritual well-being of the patient. It's very clear in the CDPH letter and the guidance that this is supposed to be a person-centered policy that should allow for visitors to come during hours that are convenient to the visitors. So they specify non-work hours, and at a minimum should be 30 minutes of allowance for time if the facilities are trying to come up with a policy to stagger visits. So I know there was, I think, some questions around that. They don't put a maximum on it, but they do say that there's a minimum of 30 minutes. And that with regard to allowing for visitors to come visitation during outbreak status, or for visitors to come and visit people that are in quarantine, that is allowed, but that the visitor must maintain, again, those infection prevention control and wear proper personal protective equipment. So adhere to the same personal protective equipment standards that staff are adhering to, with the exception of there's not a requirement for them to necessarily wear the face shield or eye coverings as long as they're maintaining distance. The next part, and as usual, I mean, where it has been the case for a while, this is all within the context of these limitations are all within the context of non-compassionate care visits. So this is the visits that must be allowed that are that are not considered compassionate care visits. Compassionate care visits are allowed at any time, regardless of tier, regardless of person status. So they would be allowed even to, this is the one exception where someone who may be in isolation, meaning they are COVID positive and still considered infectious, compassionate care visits are allowed in that context. And that's the only context in which they are for those situations. With regard to outings, the separation between essential and non-essential visits, as long as the person is fully vaccinated and is participating in an outing where they are, even if it's non-essential outing, where they are not exposed, and there's no known exposure, and they return and are screened. They need to be symptom screened. They need to be questioned about any exposures and whether or not they complied. If they do an outing where they are not complying with the our standards of masking and physical distancing with non-vaccinated people, then that would be someone that the facility could decide to put into quarantine. But in general, if they don't, if they're returning to a facility without any known exposure risk, there is not a mandate to put them into quarantine again. That's similar to the new admits now. We are not requiring facilities to put everybody into quarantine on a new admit if they are fully vaccinated. If they are not fully vaccinated, the quarantine still applies. So I just want that to be clear. I think I'll stop there. I think those are the main points, and then I'm going to take questions because I know there's a lot of them.
Thank you, Dr. Levin. We appreciate it. Want to remind everyone that we're recording this today. We will share with this tomorrow with everyone who registered. I've also added a link in the chat, which is the guidance to CDPH, which is California Department of Public Health. That is their guidance that was most recently released, PIN number 2022.6. I'm sorry, AFL 2022.6. I'll have several additional links we'll add to the chat. Dr. Levin, I want to start by kind of defining some terms. So you use the term, essential outing. So, or essential, I think that's what you said, sort of like if someone has to go someplace. So can you maybe define what is an essential outing? I would think dialysis, right?
Right. So essentially, we've tended to call essential outings to be to a doctor's visit, pharmacy, even, you could put into their, necessary legal, stuff that you have, the stuff that is necessary for maintaining your ongoing physical and well-being. So non-essentials were, essentially elective, right? You're going out to lunch, social visits. So I think that honestly, I think that was what we were using. I think when we had a lot more restrictions on what would be imposed upon return. And I think now that we're really essentially saying that what's more important in terms of that decision is the vaccinated status of the person returning and the screening of the person returning in terms of what activities they participated in on that outing and whether it is at risk for exposure.
So if they left and they went to the dentist's office and then they went to the grocery store, picked up a couple things and came back, and they observed masking and sanitizing their hands and social distancing, and they didn't have a known exposure, which they wouldn't, they're good to go, right? No quarantine required when they come back.
Correct.
Okay. But, and you're saying, what I hear you saying is there's not so much a distinction between where they go, it's more about the practices they maintain. So if the family takes them home and they have a huge indoor party where no one's wearing masks, that might be an issue of concern.
Correct. Exactly.
Right. And so when you're saying social distancing, I've heard in the news a lot lately, there's different standards. Is it 3 feet? Is it 6 feet? Is it 10 feet?
Right now it's still 6 feet.
Okay. That's handy because I'm 6 feet tall. So if I just lay down, I'll know how far it is that I should be sitting. Okay, so let's talk about some visits, because I've gotten a lot of people who've written me emails today who are saying, I want to go on a trip with my daughter. I want to go see my brother who I haven't seen in a year. Is there a limit to how long someone should be gone? So if they're going on a 3 or 4 day trip, does that affect any of the guidelines you're talking about?
Right now, no, not within the way that the guidance is written. Again, it's back to their vaccination status and their practices in that. Yeah, so that's that. Those are really the things that would determine where they go in terms of the quarantine. I will say that technically there's still the travel advisory up for California state. So which is 120 miles. That there's that at that level, but that applies to all the general public.
So will you remind us what that is? It would be great to just, I think we could all use a refresher on that.
Yeah. So right, I don't know, they just haven't changed it yet that I've seen. I suspect they will, but right now the travel advisory that came out in January is that if Californians travel outside of their home area by more than 20 miles or outside of the state or international, upon return to the county, they should consider if their travel, again, they use the language of non-essential, so they weren't going to do healthcare, I think, that they should do a 10-day quarantine upon return.
Absolutely. Thank you for that reminder. You know, I think a lot of folks are unclear because the CDPH guidance and CMS, that governs skilled nursing facilities. So that's about 30 facilities in our county. But most of our residents are what's in a residential care facility for the elderly, whether that be a big fancy assisted living or a smaller 6-bed. And so the question is, hey, I'm hearing that skilled nursing can do X, but my assisted living is not scheduling anything. And so I'm wondering if we can talk about this idea that RCFEs are getting ready. They should be preparing their guidance. And we've told them kind of it's likely going to mirror Department of Public Health. And at this point, technically, they are not allowed to be having visits. Is that correct?
No, they are allowed to be having visits. You mean at the assisted living facilities?
Yeah, because we're hearing some people say, hey, wait, why can SNFs, but why can't RCFEs?
Yeah, no, so RCFEs should be allowing visits. Now, many of them were in outbreak status, and so they suspended visitation if they were having large outbreaks. And that's still, that is still possible in terms of that negotiate. That's when you're in an outbreak status, the local public health department investigator, especially if it's a spreading outbreak, may put into place in more restrictive visitation policies. But from right now, the general guidance is that they should be allowing visitation indoor and outdoor without an outbreak status, or even at this point now, what it's changing to is that we would initially instruct them to limit visitations upon initiation of an outbreak until we understood the extent of the outbreak, and then quickly reverse it. At this point, we are saying that for the vaccinated residents, that the visitation should be able to be continued in those initial stages of an investigation.
Okay, thank you. So if a resident happens to have a roommate, and you've said, look, if the resident's vaccinated and their visitor's vaccinated, they can meet in room together. But what if there's another resident in the room Is that still allowed, or do the family then need to meet in a common area?
Yeah, so the recommendation is that they meet in a common area, or that other roommate is not in the room when they have the visit. So that arrangements are made such that the in-room indoor visits can occur without a roommate in the room, regardless of the roommate's vaccination status.
So, you talked about allowing some sort of limited, I think they said limited physical contact. Does staff from a facility have to supervise the visits, or does the resident have the right to privacy to meet in their room or a common area without supervision?
Yeah, so they also reference that in the CDPH guidance, which is that there should be allowed for privacy and dignity in the visits, that the visitor should be counseled and instructed on the core principles of infection prevention and control. And if it's felt that they can't follow those, then of course, that visit should not occur. But the language also really asks that they that is the privacy be respected in terms of the visit and not be supervised, watched over.
Is there a limit of how many people could visit a resident at a time? So let's say it's, daughter, grandson, nephew, brother-in-law. Is it all at once? Can they meet there in a safe space, or does that have to be everyone's scheduled individual visit?
Yeah, so this hasn't really been addressed. They did say, instruct the facilities that they could limit the number of visitors, and that it was reasonable to limit the number of visitors to a limit that would allow for maximizing everyone to have the opportunity to have visitors, right? So if you're trying to schedule as a facility, time slots for certain residents to be visited, and your common room where you're trying to cordon off the spaces can only fit 3 people, then they may limit to 2 visitors at a time for any given person, or 1. So that there's not real regulatory language about that. We're not going to say anything specifically about that, but it is reasonable and expected that facilities in their visitation policy will put some parameters around that allow them to keep the physical space, larger space, safe for everyone. There's also language that people should not be wandering around the facility and moving around the facility. They should go to whatever place it is that the visitation's happening, whether that be in room or in an indoor communal space or an outdoor space, and that the facilities are also instructed to have clear signage, so that is movement and contact is limited within the facility.
Okay. So we're coming on wedding season, and I'm hopeful that many of folks will be able to tie the knot this year. So if there is, say, like a family wedding or an outing and everyone's been vaccinated, they're 2 weeks post their last, visit, everyone's vaccinated. I saw that, CDC came out with guidance and said, like, oh, in that scenario, maybe you could gather indoors without your mask. Does that apply to sort of larger gatherings where everyone's been vaccinated?
Yeah, we still have within our county the limitations to gatherings. So as of now, per our health outings, there's still a limit in terms of volume of the gathering.
So as you said before, we should still practice mask wearing, social distancing, cleaning our hands, not touching our face. We should still, regardless of our vaccination status, we should still practice that.
Right, exactly. And if you're having a gathering, in terms of this general public guidance of CDC, that all fully vaccinated people could gather indoors without masks, that's still limited to 25 people from 3 households, right? By our county health order.
Right. Okay. So you could have a wedding for 3 households, but beyond that, that's going to be a little problematic.
Right.
Okay.
As of now. Yeah, and as you said, we're on the surfboard, so this may change if we, fingers crossed, keep moving through the tiers, move to the orange tier.
Yeah. So I think the question is, so you've clarified that, look, if the resident's been fully vaccinated and their visitors been vaccinated, they can meet in their room. If that's not an option because for whatever reason, or they have a roommate, they can meet in a communal space. It's obviously cleaned. And then they can also, of course, always continue meeting outside as well. Are we clear on those things so far? Is that right?
Yes, and even if the resident or the visitor are not fully vaccinated, they can still have in-room visitation. They just can't have the physical touch.
So the real push to get your vaccine is not that you can't visit, it's that I might not be able to give mom or dad a hug. That's really the big issue.
Yeah.
Okay, so I don't know any better sort of demonstration of why you wouldn't want to get the vaccine other than that. I think that's pretty compelling.
Yeah.
So if a family member goes to a facility, and let's say a facility does believe that they have to demonstrate their vaccine status, that is not true. Is that correct? Like the family doesn't necessarily have to disclose that unless they're planning on engaging in physical touch, or is it just an honor system?
So we, neither the state nor are we putting in that into regulatory language, but the response that we've had to the facilities is that's a reasonable request, that they should be able to show their vaccination card. Everybody who gets vaccinated gets a card, and you can take a picture of that card and have it on your cell phone. You know, I don't think the facilities are going to be unreasonable, but yeah, it's I think that's something we have communicated, that we're not putting into regulatory language, but we don't think it's an unreasonable policy to have in their visitation policy as a facility.
Yeah, excellent. Thank you for clarifying that. So these guidelines, are they enforced? Are they available right now? Is there a delay on them? What's the timing that someone could expect to be able to go in for a visit?
They really should be effective immediately. So, you know, I know facilities are trying, I would ask people to, most of these facilities have done some draft guidelines or you know, asking about instituting it. So I know that they have some channels, sometimes the bigger ones that they have to go through as a corporate, but our expectation is that these are being rapidly enacted, if not already there.
Okay. And so if someone's, I would just say to everyone, I hear you saying like, what if my facility's not listening? They're not following the guidance yet. I would say that's a great opportunity for you to call the Ombudsman's office. I will add the phone number to the chat, and we are happy to address this for you with a facility. Happy to give you information on what your rights are. I also really want to say is we're always on the side of residents, and therefore that means families. But I would say that let's also remember that we have asked these facilities for 12 months now to keep this disease out of their building, and recognize that they want visitors as much as everyone, but it does take some time, especially for larger buildings, to create policies. So everyone can't be in there on a Saturday. You might have to visit on a Wednesday. We got to make room for every family to come and visit. So what if a family member, maybe they're not able to get, or they choose not to get vaccinated? Are there any specific visiting protocols that they will be restricted to?
So again, if they choose not to get vaccinated, then they still are required to be able to visit across all those outdoor visit, indoor communal space, and indoor in-room. They are just limited to from that physical touch perspective. So they have to screen, obviously they have to screen, you know, negative for the symptom screening, and not be have a risk for exposure, so that every facility is required to screen any visitors coming on site. If you meet those screening requirements, then you have to maintain the core principles of infection control. But your type of visit and location of visitation should not be limited at this point.
Okay. And again, if a family member was encountering this, you can please call the Ombudsman office. I added it in the chat, and we're happy to help sort this out for you. We have been back in building since August, and we know how much your family members are excited to see you. And again, so you just answered that. So it's not really going to matter if someone can't qualify for the vaccine, but would be happy to take it. The only restriction, again, is going to be that physical contact. Okay, just want to make sure everyone's really, I see a lot of questions about that. So again, talk to us about what residents can expect in buildings. So we're, a lot of residents haven't been able to dine communally for many months, and they're really excited about social activities and be able to dine together. Can you talk about what those current restrictions are?
For the residents within the facilities?
Yes.
Yeah, so again, communal dining and group activities are allowed with those same core principles of infection control and prevention. So still the requirement that they wear their masks on the way to the dining room, and then in the dining room they're at tables that are allow for accommodation of 6 feet apart. While they're unmasked, that there's cleaning protocols between sessions, trying to cohort people potentially, and especially in these larger facilities, such that it's always the same sort of cohort of people that are dining together or doing the group activity together. So you potentially reduce the risk of exposures outside of a larger group. So it's really trying to institute, and this is more guidance that's given to the facilities in terms of thinking through how to start implementing this, strategies for just reducing the risk, right? We're in a risk reduction mode at this point. We do not want to go back to where we were before. And we know, we still have a lot of unknowns. We don't know how long the immunity is going to maintain. We're worried about the fact that some of these our populations we're talking about may not have as robust of an immune response, so may be more at risk should they get exposed. What we do feel confident about, I think, and what we know at this point, though, is that even if they aren't as protected, they are protected from severe illness and death. We have not, all the vaccines have shown to be incredibly, almost 100% effective at preventing the most severe consequences of COVID infection. So our risk reduction balance is a lot better now than it was before.
So I got some questions in the last couple of days from families saying, I don't want you to open up the building. Like, there's still the variants, and I'm worried about what's going to happen to my family member. So can you talk about, again, you've done such a great job in the past of talking about the vaccines and what they prevent. Should this be of concern to family members? And can you also talk about, we've all seen in the news that some staff may choose not to be vaccinated right now. Does that provide a threat to their residents? And is that something that families should be worried about?
Sure. So on the first question with the variants, I think, we are still learning a lot. There's active monitoring at the state and the national level. The state doing whole genomic, anybody that gets a breakthrough, meaning they were fully vaccinated, but they come up positive on the regular screening testing within these facilities, which that hasn't changed. All facilities are still required, for at least for the skilled nursing facilities, to do weekly testing of all their healthcare personnel. For the residential care facilities, it's monthly testing, so a quarter of their staff every week for 4-week cycles. So that's our way of continuing to doing ongoing screening and surveillance testing for potentially, yes, as you say, the healthcare personnel who may have decided not to get vaccinated, or for healthcare personnel who did get vaccinated, and if there's a breakthrough. So right now, if there are those breakthroughs, they are being sent to the labs at the state for whole genomic sequencing. And what we know from that is that there has been very little penetration of the variants so far in California, in terms, with the exception of the UK variant, which is still a very small percentage, but there's some speculation that it will become more serious. What's good news is that, again, all the vaccinations, so far what we know is that even though that those variants may present the risk of they're more transmissible, and they may have some more significant severity of illness, that the vaccinated state still seems to be protective against that severity of illness, as well as the symptomatic infection. So, and what we also know is the more people we get vaccines in arms to, the less chance there is of those variants ever taking hold. So it's, it's like this race. We're staying ahead. We got to stay ahead of the virus, and the virus is trying to, get enough of us to be able to spread and set root down. So yeah. So I think in terms of the healthcare personnel who decide not to get the vaccination, we're continuing to try to offer it and encouraging people, obviously, but they will also be required to be tested, as well as the vaccinated. That may change. There's some talk that the CDC is going to say that for fully vaccinated people, they may not need to have that same level of surveillance testing, but that's not changing yet.
Okay. I just want to add that I just dropped the link to the Contra Costa Health webpage for COVID as it relates to long-term or congregate living facilities. That's a great place to stay updated on what the county is doing, provide a dashboard, any information. That's a great resource to bookmark and use continually.
Yeah, and there's some really great resources there for families and caregivers as well. It's broken up into sections. So some of them are more resident and family oriented, and some are more facility oriented, but there's a lot of overlap too.
So sometimes it's fun for family members to come in the building and eat a meal with their resident, right? It's like going to a restaurant but not having to drive. And you get to see what they are eating on a daily basis. So can a family member eat a meal in the building, in the dining hall with the resident? Is that a different answer if they've both been fully vaccinated or if they have not both been vaccinated?
Yeah, this was not, I thought about this question. This was not addressed in the CDPH guidance, nor in our guidance specifically. Really the parameters that were put around communal dining would suggest no, that it will not be possible in the facility. You would be able to take your person outside of the facility for that, but in terms of their being able to control the infection prevention measures within the facility, we're not at that point yet in terms of visitor, just because of the potential risk posed to other residents within that facility.
Okay. So I saw a news story that said that some of the animals at the San Diego Zoo are receiving the COVID-19 vaccine. And I think this brings up a really important point, which is, can pets from the outside come in a building? Are there any restrictions on pet visits in rooms?
No restriction on pet visits.
Excellent. I just want to say I didn't actually make that one up. You all know I do love my Walter, but it was a really good question and I did love it. So I think that this situation brings out the natural, like, what if in all of us of like, why can't I engage physically with my family member if I haven't been vaccinated, but an unvaccinated staff member can deliver really intimate and ongoing care? Can you just kind of speak to that conundrum for us?
Sure. The staff members are following a level of source control, personal protective equipment, and that includes, a full face shield with any prolonged contact, and PPE requirements. That's highly regulated and monitored within these facilities in terms of the Occupational Safety and Hazard Association, and so that sort of discrepancy is that those are it's apples and oranges in the sense of the protection that's being afforded and it's obviously within a work environment. So again, being regulated and supervised within those parameters of employment status. They're being, again, monitored with testing. They're, not obviously allowed to work if they need to be quarantined with exposure or put in isolation for a infection.
Excellent. So if everyone in the building's been vaccinated, oh, I'm so sorry, guys. We're all at home, right? If everyone in the building's been vaccinated, let's say the facility has 100% staff and 100% of residents have been vaccinated, particularly in a small building, do they still have to continue to wear a mask just in the normal course of like in the living room?
So, I mean, I guess this is where you're talking about like the smaller board and cares. Yeah.
Yeah.
Yeah. Yeah. I don't think we've addressed this, but to me, that is more like what we're dealing with, which is a home environment type situation. So if everyone's fully vaccinated, I know technically it's not the general public guidance, but that is a logical, rational conclusion that that if that's the care environment and there's not large amounts of sort of, other visitors and the volume is just down, that would seem to be certainly in alignment with that guidance from the CDC for the general public.
Mm-hmm. Okay.
I would just say that's something we haven't really, addressed, but good
Yeah.
question.
So again, I think it brings out in all of us of like, what if this, what if that? Like we want to know all the scenarios.
Yeah.
And I think one of those is facilities have been very protective of the new admission process over the last 12 months. So if a new resident is coming in, they could be coming in from a hospital, they could be coming in from the community at large, they could be coming from another long-term care building. So is there going to be a testing or quarantine requirement for those individuals? Additionally, vaccination screening, and should someone receive the vaccine maybe 2 weeks before they move into a building?
Yeah, so we are saying that for people who are fully vaccinated without a known exposure, that they do not need to be placed on that quarantine with new admissions or return to the facility. The things that would change that is that if they are partially vaccinated, they are still required to do that quarantine at the initiation, or if they were fully vaccinated but have a known exposure. So not just they were out in the community, but they were actually in a proximity to someone who was known to have COVID-19. And of course, if they have any symptoms that are concerning for that, there will still be the requirement to test if they haven't been tested previously positive in the past 3 months. We aren't requiring testing for people that had previous positive tests within the past 90 days. I think that is, did I miss any part of your question, Nicole?
No, I think it's that, but you bring up a great point of, I wonder if you could go over briefly the requirements for staff testing at long-term care, because I think families might not necessarily be aware of how frequently folks are testing. So can you talk about that?
About the testing in our residential care facilities?
Yes, what that requirement is and how frequently that's being done.
Sure. So for just in general, no outbreak, there's been no cases of COVID in the building for the past 14 days, then you're on surveillance, sort of screening testing, which requires that all staff be tested, but not just staff, personnel. So anybody that's coming into the facility, and that includes, us as the health department, that includes Nicole and her Ombudsman officers, at least monthly. We're testing weekly, often because we're going into the skilled nursing facilities as well, which has a higher requirement threshold. But with the negative test, if someone turns positive, if there's a new positive, then it goes to response-driven testing, which means there's weekly testing of everybody until you get 2 cycles with no one positive. The initial, if one staff member turns positive at the residential care facilities, that may not trigger full response-driven testing. If that's determined in the investigation to be a community exposure and there's no person, ideally you do testing with anyone that person was exposed to. If those come back without any positivity, then potentially that person, it doesn't trigger that weekly testing for all personnel in all residents. But if there's a resident who turns positive, then that does trigger response-driven testing.
a little bit along that same line is, you have lived through this last year when there were times when we had a significant number of outbreaks. Can you maybe share like what was kind of the high point and where we are now, just to give a sense of the scope of what we've been battling for the last year?
Sure. So we had 3 peaks of outbreaks in April, where we got up to probably about, I think at its peak, it was probably in the 30s, the mid 30s. We had a end of August, September peak, where it was less significant. And then we really cooled off. And then we had a January peak where we were up to over 130 facilities that were in outbreak status, and that included skilled nursing facilities, residential care facilities. It also included other non-elderly residential congregate facilities. But it was very overwhelming. I'm so happy to report we are back down to under 20, with many of them being very limited in their scope, which means we are getting, 1 or 2 staff member that's likely a community acquisition, and no evidence of spread to residents or to significant staff within the facilities. So you see the vaccines go up in terms of administration to these facilities, and you just see the outbreaks plummet. It's such a clear graph. There was a really, I'm sorry, I should have got that graph up, but it's astounding. So it's really, we're in a really good place right now than we've been in the last year. Yeah, someone made a comment in the chat box that, and you're right about outdoor gatherings. The capacity, I said 25 people, that's indoor, but outdoors, it's up to 100.
We have an informed audience. I'd love to see that. So I know we're towards the end, but I'd like to run through some of the scenarios we talked about at the beginning, because I think we all need to hear it a couple times. So let's say a building, the resident is vaccinated and the visitor is vaccinated. I can visit them outside. I can visit them in a communal space. I can also visit them in the room. Is that correct?
That's correct.
Okay, so I can just throw my mask off once I walk in their room. Is that right?
No. Okay. So it's very clear. I'm sorry, and I should say, with the brief contact, when you're hugging, holding hands, grooming, helping, assisting with feeding, still the one thing that's not happened now is the 6 feet distancing. But the expectation is that both visitor and visitee are masked, that there's hand hygiene performed between those activities and touching. So bring your hand sanitizer bottle that everybody carries around now.
Okay, so in that same scenario, resident vaccinated, visitor not vaccinated. So all the same protocols, plus we can't have that physical contact. Is that correct?
Yeah, that's how it's written right now.
Okay. So, so we're saying that basically if we've both been vaccinated, we get to have a brief physical contact, but we're still going to maintain that face mask. Even if we're assisting maybe changing or feeding or doing any of those activities, we want to maintain that strong standards.
Yeah, I mean, obviously it was funny when they wrote this limited brief contact and then, said feeding, it's like, with mask on, like, of course, like then the resident doesn't have their mask on, but it's really about protecting the resident. So, obviously if in that context, there is times when that is breached, there is at least you as the visitor are doing your best to, on the small chance that you could have an asymptomatic infection with a breakthrough, that you're not putting your loved one at risk.
Okay. So, someone rightfully pointed out that some folks with dementia may not be able to consistently wear a mask. So if they take theirs off, should we freak out as long as we're wearing our own masks?
Yeah, you shouldn't freak out. And I think, again, we recognize that this is setting up what would be the best way to do the most risk reduction in the safest way possible, in a way that facilities can at least design policies that keep as many people and their residents safe, and put in some parameters and guardrails. But we understand like there should not be a situation where, that you're being, watched over the whole time, or, not able to visit because there's some breach in these, as long as you're making your best efforts to follow those policies. And we recognize that, this is different than what we're saying. We know potentially you're going to take your loved one home or go for an outing where you're unmasked and touching, but this is for really the source control within the facility, so the facilities can keep their whole environment safe.
So, okay, so our family member is actually ready to go outside. They have a doctor's appointment, they have a dentist appointment, they just want to live it up at a restaurant, they want to go to a family gathering within guidelines. Is there any restriction on the type of activity they are engaging in that would prevent them from coming back to the facility and having to quarantine?
Not, I think then it's really the guidelines that we're talking about in the, the general public that we still have in place. So, it's again, that screening upon return, no known exposure. They haven't been, around a bunch of unvaccinated partying college students.
Yeah, so we're hearing so far that we can go in buildings, but we still need to practice safe practices, wear a mask, don't freak out if someone with dementia can, it's okay. They're allowed to leave to go to both those important visits like doctors, dialysis, dentist appointment, grocery store. I would say hair is essential, but I understand not everyone feels that way. All that fun stuff. But they're also allowed to engage in like social activities, like the restaurant, like maybe a family gathering, maybe going on even a couple-day trip. But we're still saying, please be vigilant in your protocols, and please be honest with the facility when you return, in the event that there was, maybe you just couldn't get people to wear masks, or maybe you found out later on the way back from the trip that someone tested positive. Be really transparent about that information.
Yeah, definitely. Yeah, I think that's the way we're all going to take care of each other.
Mm-hmm. Right.
Until we get to community immunity with the vaccines.
And so this guidance is effective immediately. Is that right?
Yep.
Okay. So we have found out that we can take people out to go eat, but we can't necessarily come in to enjoy a meal with them. That needs to be outside.
Yep. That's still true. Yep.
Mm-hmm. Okay. And
you should know too that the guidance we're giving to the facilities is that they should try and do things like cohorting of things. So if you as the family member know that your loved one is has a certain crew at their facility, like some, advocacy around can we help to design this with you? Can we help you figure out who your cohorts are?
Okay. Could I bring food in from the outside and eat in mom or dad's room?
That is I know people definitely can bring food from the outside in. I think that I think if I was a facility director, would say that's not following the core principles of infection prevention and control that we said, with trying to maintain as much that, with limited brief contact. So I don't think that you as the visitor should be eating with your loved one in the room. It's still in the facility and still within those parameters.
Yeah. I think the hard question is folks are like, but how long is it going to be like this? And do you have a sense of do you think these are forever guidelines, Dr. Levin, or do you think that there's a time when things might be more we know as normal?
Yeah, I think there's going to be a time when things are a lot more normal, and we will be, yes, I do.
So Dr. Levin, I always want to give you, I'm sorry, what?
I want to say again, I think, that graph that I saw with the vaccinations and the plummets and outbreaks, I think we just need a little more time out of the, in feeling secureness around this before we just go right back to where it was. So bear with us, but I do see us getting back to normal.
So Dr. Levin, I'm going to, in a second, turn it back over to you for the final word. I just want to say to everyone else, remember, if you're getting a little bit of pushback from the facility, you can call the long-term care ombudsman. I'm dropping the number in the chat again, but for those of you who are listening, it's 925-685-2070. You can call us and the ombudsman will be happy to help you resolve this issue. What we learned today is that in many ways is a significant step toward return to normal, if you will, where even in-room and in visits are allowed, but we're still going to maintain, and I'll keep a strong vigilant guard and wear our appropriate PPE, give a quick kiss if we're vaccinated or hold a quick hand, and then maintain that. Residents can leave the building, even for fun stuff, without returning to quarantine, but we ask that folks are still vigilant and are still really transparent with the building about, if they were around someone that something may have come up in the interim around positivity or potential exposure. So does that feel like a good summary, Dr. Levin?
It's an excellent summary, Nicole. Couldn't have done better.
Excellent. So you send us off with, we're a year in. What's your final word for us today on this webinar?
My final word is we've made it through a year. We can do it for another few months with these hope on the horizon and feeling that joy each day of these steps we're able to make. Just stay vigilant. We're not there yet, but we will get there.
Oh, that's perfect. Good night, everyone. We will see you again next time. Bye-bye.